Hello, how do you manage high blood pressure in pregnancy? This is a question that has been asked many times, and without further ado, we shall go to the first step. And the first step is this: just make sure that you keep your prenatal appointments. It's very important for you to attend your prenatal or to go for your prenatal appointments. The main reason is this: when you go for your antenatal, it will be very important because the midwife will take your blood pressure readings and she or he will advise on what needs to be done. The normal and recommended blood pressure readings are supposed to be 100 up to 140, that is the upper value, also known as the systolic value. It's supposed to be 100 up to 140, and the lower is supposed to be 60 up to 90. When your blood pressure readings have been taken at the prenatal clinic and they discover that probably they are higher than actually 140 over 90, which is the maximum, then advice will be given on what you need to do. And secondly, the next way of managing high blood pressure in pregnancy is just make sure that you take your medications as it was prescribed to you by your doctor or gynecologist. When you take your drugs and you are having high blood pressure in pregnancy, it is very important because this ensures that the blood pressure is kept low, is kept within the normal ranges. Next is, in your diet, just make sure that you limit salt intake, limit sodium intake. Specifically, common salt or table salt has sodium in it, and sodium has been known to be among the chemicals that are really not advisable, that are really not so good, because they have a tendency of absorbing more water into your system, bringing about an increase in the blood pressure. So in summary, our second point is limit your salt intake. Just make sure that when you are cooking food, whatever little salt you add in, it should just be enough. Do not add raw table salt. Next point is we've talked about limiting sodium intake. We've talked about attending your antenatal care. It's also advisable that you get time and you have exercises. Take mild exercises. This could be, actually, you could walk, you could swim. If you are pregnant and you can swim, it is very advisable. Just make sure that you do some mild exercises. Keep your body active. Next point is make sure that you manage stress. If you cannot manage the stressor, then all the stress, we advise that you should avoid the stress. Next point is just make sure that you calm down whenever you are stressed, and of course you could listen to some music. So in this lecture, we've talked about the few tips how you can manage high blood pressure in pregnancy, and I hope you've learned a question, you've learned something. I mean, if you have any questions for me, you feel free to ask all your questions in the comments. Question of the day is, how do you manage high blood pressure in pregnancy? Let me know about the answers down below in the comments. Remember to like, subscribe to our channel for more of these tips, and have yourself a fantastic day. I'm Gerald Massa, I'm a health educator, and bye bye.